Welcome, everyone. Thank you for joining us for Nourish's From Trump Tariffs to Patient Trays, Healthcare's Role in National Food Security. So I'm Hayley Lapalme, co-executive director from Nourish and an 11th generation French-Canadian settler, originally from the Haldimand Tract, territory along the Grand River. But I'm joining you today from my home on Lekwungen territory on the southern end of Vancouver Island. So we are here today to talk about land, food, people, and wellness, but also, and quite unfortunately, also about borders and the silly but consequential things that humans decide to do with them. It's a messy and an emerging situation, and today's conversation is an invitation for all of us, panelists and participants alike, to share and reflect on how we want to meet the moment. On March 4th, President Trump's 25% tariffs on Canadian imports and our own retaliatory tariffs the next day took effect. Now we're on the precipice of a potentially catastrophic trade war with an unpredictable president who my team has asked me not to name too much by name through this webinar. I guess due to his similarities of the other one who shall not be named. So for 9 years, Nourish has been building capacity in healthcare and with policymakers to move food to a more central place in health and healing. During that time, we've seen progress in supply chain transparency, an effort to source more locally, a modest recognition, despite a preponderance of evidence, of the power of food as medicine. And we've seen gorgeous efforts to grow gardens on healthcare land and rooftops, to build relationships with Indigenous stewards and knowledge keepers, and to work with local producers, sometimes even through forward buy contracts, or as is in the case of Quebec, through commitments to certain percentage of organic foods. However, to meet this particular moment, healthcare institutions, like all public sector facilities, from campuses to corrections, lack a clear mandate, some all-encompassing vision to really harness the $4 billion purchasing power and the missions in healthcare to advance well-being, to really build health and wealth in our communities. So in other words, what does it look like to get beyond the rah nationalist buy Canadian, but about building, planting healthier futures for all Canadians? Cindy Woodhouse, the Assembly of First Nations National Chief, said this past week that the tariffs and the threats from Trump are unacceptable, but added that Canada will not defeat Trump's colonialism with more colonialism in our country. So there's a clear opportunity to step up and imagine the type of future that we would like to see. Is it time to realize the promise of prairie illuminating plant forward menus that make healthcare facilities the official leguminati? Or is it time to get rid of hospital vending machines stuffed with overwhelmingly American, highly processed chocolate, baked goods, and snacks, and replace them with on-site farmers markets, rooftop gardens, tasting panels, and delicious eating environments that nourish staff and patients alike? Or maybe it's just time to eat with the seasons a little more and to activate the full potential of the Canada's New Food Guide as it intersects with the Lancet's Planetary Health Diet. And to do so in a culturally mindful way that recognizes fundamental differences between globalized, industrialized food systems and land-based, culturally stewarded food and food systems. And if I imagine a little further, what of the workers in the auto and aerospace industries, among so many others, who will see their household incomes contract? Do some of them maybe want to be retrained as small plot intensive spin farmers of the future, delivering medically tailored meals and produce to patients managing their conditions at home? Okay, well, maybe I'm starting to get a little bit carried away. You get the picture. Very pragmatically, we see every day at Nourish that institutional buyers are keen to support local food systems, but too often the supply isn't there, the manufacturing or processing capacity has moved south. The scale or the price don't work with healthcare's average $8 a day per patient budgets. And often producers just don't even know how to crack into the healthcare market because frankly, there are few incentives for them too, not least of all the complexity of the process and the structural favoritism of incumbents. So right now, a domestic food system crisis and a Canadian health system crisis each ache for the potential of mutually reinforcing food and health systems that build the health of people, ecosystems, and planet. The Canadian health sector has a real opportunity, particularly to really provide a stable and reliable source of demand to scale up more just, resilient, regenerative food systems across the country. So throughout today's conversation, we're going to be calling for bold, honest, and critical reflections on the way forward. And we'll be listening for the ideas and allies to accompany us in our work to Ottawa and into hospital boardrooms to really be championing this critical opportunity to invest in Canadian well-being. So throughout the conversation, please use the chat. Keep the conversation interesting, rowdy, and respectful by using it to disagree, agree, probe, introduce new questions, and I'll try to track that along the way. And so let's get started and meet our esteemed panelists, who will each take a few moments just to say hello and tell us how they are relating to the tariff crisis today. So joining us from Agriculture and Agri-Food Canada, we have Jason Bergeron. And I meant to check the pronunciation of your name because I realized I didn't. So over to you, Jason.
No worries, no worries. Jason Bergeron, Director of Food Policy at Agriculture and Agri-Food Canada. And what a pleasure it is to be here today. I'm joining you from the traditional unceded territory of the Algonquin Anishinaabe people, and very much look forward to the discussion, in particular identifying new opportunities and solutions to strengthen Canada's food systems and improve food-related outcomes across Canada, and taking this moment to reflect and to build, as well as to respond to the current challenges. Thank you.
And from the Organic Trade Association, we have Tia Lofsgaard.
Good morning, everybody. I'm Tia Lofsgaard. I'm the Executive Director at the Canada Organic Trade Association. We're national in scope and represent everybody in the organic value chain, from growers, seed growers, manufacturers, all the way through to retailers and even associations and supporters such as academic institutions. I've been very involved, of course, and we're a trade association, so you can imagine our life has been very busy responding and finding out the impact of the tariff.
All right, thank you, Tia. And you froze for me a little, but I think we got the gist of it. So joining from Food First NL, welcome CEO and two-time Nourish cohort member, Josh Smee.
Hi, folks. Thanks for having me on this. So as Hayley said, my name is Josh. I'm joining from St. John's, which is on the traditional territory of the Beothuk and the Mi'kmaq people. Our organization, Food First NL, is a province-wide organization here in Newfoundland and Labrador. We work to advance the right to food in this province through advocacy, through programs, through engaging with lived experience. And in that context, obviously, one of the biggest things on everybody's radar screen, if we think about what the right to food really means right now, is tariffs. And practically from our lens, we've been convening conversations here, trying to bring together people from across all the different subsectors, both inside and outside of government, to try and wrap our heads around what this means, and particularly what it means in a relatively isolated, relatively rural, far end of the supply chain.
Great, thank you. And welcoming from our inaugural first Nourish cohort from the Nova Scotia Health Authority, Brenda McDonald.
Hi, everyone. Good afternoon. Thanks so much for the invite. I am the Senior Director of Nutrition and Food Services across Nova Scotia Health. And our team looks after more than 40 facilities, including hospitals, long-term care, and health centers. And right now we're working really hard with our suppliers and our vendors to ensure we have the right food to nourish our patients. So happy to be here, happy to learn so much from all of you. Thanks again for the invite.
Thank you, Brenda. Yeah, we know several of your colleagues have their heads down trying to make sure that there's no disruption to the foods getting to out on patient trays. Okay, great. So finally, from the Green Circle Food Hub, we have farmer, founder, and an old friend of mine, Dave Cranenberg.
Hi, everyone. My name is Dave Cranenberg, and I am a farmer about an hour northeast of Toronto. I'm one of Canada's fewer and diminishing small farmers out there, and there's no strict definition of small, but its revenues under maybe 250,000. There's fewer and fewer of us each year. And 5 years ago, found myself aggregating a whole bunch of my fellow farmer friends to form the Green Circle Food Hub. We're an aggregator, distributor, retailer on their behalf, servicing homes, restaurants, and retailers across the GTA, Peterborough, and the Kawarthas, Northumberland. And I'm here to try to figure out like where that connection point is, because all of the small farms that I work with and continue to work with, and the ones approaching me, we have the capacity to grow a lot more food. We would just like different ways to get that food to people other than direct sales. So we're the folks that want to somehow feed into institutional food procurement. And I hope to share some of our realities on the ground with you today.
Great. Thank you, Dave. Okay, so Josh, Jason, Brenda, Dave, Tia, who I think has rejoined and just needs to be pinned again. Welcome today to the conversation. I think we're going to get started with a quick audience poll. So welcome all of you. Thank you for taking the time to join. We are going to just ask you a simple question of whether the tariffs or the threat of the tariffs has begun to impact you or not. So we're going to get that poll up in a quick second. And just as we're doing that, we're going to start to, okay, there we go. There's our question. So let's see. Are the tariffs impacting you yet, or the threat of them? Oh, it seems like every day we're hearing something new. Okay, so we're overwhelmingly getting an answer of yes, they are, but still like a good 80-20 split that for some, no, we're not feeling them yet. All right, so take another sec. If anyone else wants to answer, that's great. Okay, so there you have it. There's a very clear 80-20 split. Okay, so Brenda, let's start with you. And Nairi, if you don't mind, you can stop the screen share and we'll just have a look at our panelists. Brenda, will you tell us a little bit, how are the tariffs already impacting food prices, supply chains, purchasing menus? What's going on in Nova Scotia?
Yeah, it's a great question. I think right now our food prices are still fine. So it's what's going to come in April, we're quite worried about, but currently they're okay. So we're doing lots of planning and lots of strategizing about what to do come April. Our worry really is our fresh fruit and vegetables. As we all know, Canada's growing season is not long enough, and our patients are really used to having variety 12 months of the year. So we're really working closely with our Nova Scotia suppliers. We have been for a long time, and we continue to lean into those partnerships to see if we can improve upon what we already have. Part of our issues that we are currently seeing, though, is an extreme increased price of our food equipment. So in kitchens across hospitals and nursing homes, etc., what's our equipment is made of stainless steel. And so we all know that the tariffs and all of those good things. And although we have a lot of stainless steel in our country, we don't really manufacture as much as we would like to into pieces of equipment that a kitchen would use. So currently we are looking really closely at what we're buying, what do we really need it, and who in Canada can help us source our kitchen equipment. So, you know, a good opportunity for sure for the future.
Hey, interesting. So we still have a bit of this grace period, I guess we can call it, before the food prices will see the impact of those tariffs. But yeah, the other parts of the system already hit. Okay, let's get a producer perspective. Dave, how about you? You serve a primarily retail audience, but yeah, what shifts are you seeing? What are you hearing on the ground?
Yeah, so what's interesting is compared to this time last year, the Food Hub has seen a 67% increase in its home deliveries, and a refusal amongst those homes to buy American, a desire to source anything and everything Canadian. So a lot of homes and like everyday people are saying we want Canadian first, um, wherever possible. We do bring in food from further afield, and so we work with some organic distributors and importers. So yeah, we've had to kind of switch out things. And the other place, again, on like even on some frozen fruits, things that we thought we'd be bringing in that are frozen blueberries are instead product of US, right? And we are transparent about that, but in some cases we send it back. So I'm seeing a big shift in kind of home demand on things. And then on the farm itself and amongst farmers, nothing yet, but it's going to come down. Same thing. It's equipment, it's machinery. I have to bring in some new mushroom equipment for my farm. Normally I'd be getting that from the States. The price on that just spiked on me. So yeah, it's going to affect the farm budgets of all of these small farms and a lot of their decisions on do they make any capital investments this year or not, because the Canadian options for farm equipment are few and far between right now.
Okay, and very interesting. All right. Jason, what about you? Can you give us a bit of a sense of an inside look in Ottawa? What's going on?
Yeah, certainly the department's been engaging with a wide range of stakeholders and partners who are affected by the tariffs or threat of tariffs. And certainly there's a number of interdepartmental calls being undertaken. And I guess I won't try to get into the many voices, but certainly sectors that are export dependent face immense challenges. For example, Brenda, you had mentioned fruits and vegetables, but also considering Canada's greenhouse sector, which exports a large proportion of products to the northern US. At the same time, of course, those industries which are dependent on imports, whether it be for imports for further production or otherwise. So a great deal of concern in that regard and certainly monitoring very closely. And maybe just while I had the floor, we also have, I'll post in the chat, an email address that can be contacted to bring forward kind of concerns that people may have. So we're fully aware.
Okay, great. Yeah, certainly it's a time where we're hearing all kinds of perspectives from time to challenge some of Canada's sacred cows, interprovincial trade. I think there was just there's calls to question everything that's going on in Canada. So certainly a time to be considering what really we need to build. Josh, I'll go to you next. How are you thinking about this?
I think we're thinking about this in two streams, if it makes sense to say it this way, that we're trying to think about what the impacts are going to be within the food system and within for the network of organizations that we work with, who are everyone from producers to community organizations, but also what's the impact going to be on folks experiencing food insecurity. So, our province, I mean, Brenda, you're on this call, like our end of the country is particularly vulnerable to food insecurity. In Newfoundland and Labrador, we have the highest rate of severe food insecurity in the country, right? It's almost 9% of people here are severely food insecure, which is the fancy way of saying they're going hungry. And so I think in that context, we're really concerned about what the policy response is going to look like in the short to medium term. If if and when the sort of trade war reaches its fullest extent, it's going to hit food prices, and that's going to hit people, right? And some of the systems level conversations that we're having within the food system are going to take a little bit longer to, I think, bear fruit in terms of what their impact is on what our supply chains and prices look like. So I think we're trying to make sure there's also space in the conversation for income supports, and for supports that are going to reach people to top them up, to compensate for what we're going to see as a price impact, right? So I think there's a conversation that we're having and trying to convene, with provincial partners, but also, you know, keeping that on the federal provincial radar screen, that a part of the response to tariffs and part of the way that we spend the money that Canada's counter tariffs is going to generate needs to be in aid that compensates affected people, and that compensation goes beyond sort of people whose jobs are directly impacted because of the tariff caused their business to close, and goes out into society kind of writ large. So I think there's a big social policy conversation happening at the same time as there's also a conversation that we're trying to help move along around some of the things that we're talking about on this call, which is around the sort of structural barriers within our food system itself, right? And how do we use this moment a little bit, maybe, you know, it seems callous to say, but like, how do we not waste the crisis to maybe reduce some of those structural barriers? And I think there's a few in smaller provinces in particular that don't always get enough attention, that we're hoping that this might be a chance to raise their profile and do something about. So I think it's, you know, there have to be these two streams happening throughout this conversation to have like a really meaningful response. And for us right now, it just means trying
Josh,
to
I'm just gonna jump in, but we'll come back to you, and we're gonna have a chance to get into some of those questions about the, you know, the very real implications of food insecurity and the pressures on households as we go forward, and kind of what are the multi-pronged solutions that are needed to move forward and look at that. Tia, I want to go to you for a moment. Dave talked about there being more capacity among growers to produce more, but it's the selling part that, you know, farmers want to grow. What are organic growers saying?
Well, I think the thing that we cannot ignore is that the #1 market for organic in the world is the United States. And farmers that are producing in Canada, they get their economies of scale by actually selling to export markets. So what I'm hearing is that people are moving their operations to the United States or in other locations, actually doing more value added in Africa or what have you. So people are full on picking up and moving their businesses because they're so dependent on those markets, which leaves us with less jobs, less availability of Canadian organic produced. And it's becoming very challenging to imagine what this world is going to be like if you remove the largest organic market in the world. So I think, you know, in organic, there's limited options for buying inputs, for buying seeds. All these things, right as we're coming upon the growing season, is quite difficult. You know, we are monitoring this extremely closely, and we've had many meetings with the minister to just really communicate that organic, if we lose that market, it's going to take 3 years, because farmers, it takes 3 years to transition. So if they start selling to conventional markets and giving up all the work that they've put in, it will take them 3 years to come back into the system. So I'm really concerned about the long-term implications that these last couple of months is going to have in regards to farmers and food availability. And then just on the import side, we've really been monitoring the reciprocal tariffs, and there's a handful of products that we have unique codes on that will not impact the price, but unfortunately we cannot get that in writing from the federal government, and so we have not been able to make sure that the distributors and the retailers are not jacking the prices on these 68 specific products. So until I get that in writing, it's really hearsay, but you know, all the work that we've done But even some of our, board members are saying, what, we just increased our prices by 25%. So, and it's, everybody's just protecting their business right now because they don't know what's coming. And I've also heard some large retailers will not accept price increases at all. So I think there's going to be a real trickle down effect where everybody doesn't know what they're going to do, so they just increase the prices to protect their business. Yeah.
Okay, and wow, like we talk about brain drain, capacity drain, we've seen, I think particularly the meat processing sector across the country contract, some provinces no longer having, federally inspected abattoirs, any processing capacity, like any ever agricultural capacity contracting, going south of the border. That is not a good thing for Canadian food security. Yeah, wow, okay, all right, great. Not great. So
not great.
Brenda, I want to come back to you and just ask, so I mean, you're not feeling the effects of the price changes quite yet. Do you anticipate any changes to your menus and sourcing to meet some of what's coming? And at the same time as you're answering that question, I'm going to ask Nairi from our team if you wouldn't mind putting up the poll just in a moment about, we're going to ask the audience as well, kind of like anything that they might be struggling to find or anticipate they might be struggling to find food wise, whether it's produce or processed or whatever. But yeah, Brenda, what are you anticipating in terms of potential purchasing and menu changes, if any?
Yeah, no, another great question. Over the last 4 years, within Nova Scotia Health, we've really changed our food model. So our food model, I would say, is a lot more flexible than it used to be. So it used to be that we would have 2 meal choices at every meal. And so if we had a food shortage, or it would be really tricky, like we would be running around with our heads cut off, let's say. So now that we have our room service model rolled out in many of our larger places, and more to go and more work to be done for sure, our menu is approximately 30 entrees. It's like a hotel or restaurant style. So if we cannot get an item, and we've had supply chain issues through COVID, as we all know, and currently we will as we go to the future, it's a little bit easier for us to pivot because we have such a flexible model, I would say. So the flexibility in the model and the flexibility in the work, I think that our patients get to order whatever they want. People go visit them at the bedside with an iPad, or they call a call center, which has really enabled the patient to also, ask us questions. Is this from Canada? And that's what we're getting. Is this from Canada? Where is this? Like just in the last several weeks. So it's really great to see that groundswell happening. So because the food is homemade, and because it's fresh, we get to buy ingredients. So we're not looking at buying things that are already made. So I think that that's been super helpful. And, everybody's probably heard me talk about room service so much over the years. So we have lots of 87% of our patients eat everything we give them on the tray, which is wonderful. Our food wastage has gone from 40% to 13%. So I think that enables us to have like finances that we need to keep buying good food, even if it's a little bit more expensive. So I think the one thing about what's surprising is I think our patients are ready to not have strawberries, 12 months of the year. They're okay with not going to have orange juice, because we probably won't have orange juice on our menu. We probably will have apple juice and cranberry juice. And we have a great new little partnership here in Nova Scotia with a cranberry farmer. And he is now making us our cranberry juice and our apple juice. So I think so it's grown and manufactured and creates a lot of economic growth and development. So I think for us, we'll be okay. The menu will definitely change, but it will be what maybe it should have been for a long time, more seasonable. And I think with that, I think our patients and clients will be able to lean into that and know that there's a really good reason why.
Okay. Interesting. Nari, I'll ask you to put that poll up now, so that participants, you can share some of what you are currently or you anticipate maybe struggling to source and find. And it's so interesting, Brenda, just that, it's another point for room service as a way that retains the flexibility and capacity in-house to meet the patient's desires, in a timely, culturally appropriate, comforting way. You're seeing higher. So for the listeners, we didn't actually have much time to prep this webinar, so I didn't know what Brenda was going to say. But I mean, it is interesting, especially as so many Canadian healthcare organizations are signing on to Nourish's Cool Food Pledge to reduce emissions. We know that drawing down food waste, moving towards more plant-forward diets, these are big ways to be able to do that. And so it's this like compounding additional benefit with room service that you are able to be a bit more flexible. And it does make me so hopeful to hear perhaps, there is some of that willingness, and we see it in the surge, 67% surge in Farmer Dave's demand from households to eat in the seasons. Okay, so it looks like maybe the poll is it okay? Is the poll working, Nairi? Folks are putting in answers. We just can't see them yet. Yeah, I think that's what's happening. Okay, so we'll give those a second to load. We'll come back to it and give people a chance to respond. So, healthcare is really spending billions of dollars on food. With these tariffs, rather than just, a reactive trying to hurt our opponent, really our friends south of the border, I want to talk about, I've heard you all speak to this as well, how we can really use the moment to respond in a thoughtful way, really make it a moment to recommit to the values that are Canadian. I think we can be so much more than just better than America, which I think can be such a big part of the Canadian identity, but is like selling ourselves so short because it does leave so many behind. So it's really, how can we use the moment to fundamentally shift our procurement, build more sustainable food future for all Canadians? I'm thinking of you, Brenda, saying, talking about cranberry juice. Like I remember as a kid always growing up or always driving up the 400 series highways in Ontario to go camping in the summer and seeing the like Iroquois cranberry growers march and so on. Like there's got to be space for our values to come in and to really look at how all the folks who live here are able to contribute. So Jason, I want to go to you. What do you think are the biggest opportunities to get more institutional food dollars flowing to Canadian farmers, producers, and processors?
Well, I think there are a few, and I think building on Brenda's comments, and super applaud the work that your organization is undertaking, Brenda. I think there's a real opportunity to redefine the relationship that Canadians have with food and the value that they place on food and where it's coming from. I think too, this is an opportunity to look at new approaches and novel partnerships as well. We saw this during the pandemic, and I think there's opportunities to further build on that. And I think this also provides a degree of predictability when partnerships are formed for both suppliers as well as for institutions, which can lead to greater predictability, which certainly helps out in an era of instability and uncertainty in these face of these disruptions and more disruptions to come, and ultimately looking towards building more resilient food systems and strengthening local economies. So I think those are some key opportunities that we have in front of us, and how can we collectively work together to make the most of it, and building your point, Hayley, in a very positive and constructive way.
Mm-hmm. Is one of the partnerships, maybe, do you think we could see some more interdepartmental collaboration between agriculture, food, health, in terms of policy that is guiding how healthcare thinks about food and its role in food systems?
Absolutely, and that's a central part of my job as Director of Food Policy, is to work across departments and agencies to have greater coherence among policies that impact or are impacted by food. as well as identifying where those critical challenges and gaps that exist across Canada's food systems and how can they be addressed. And so in that regard, I'm always super appreciative to receive feedback in terms of what some of those barriers are, so that we have practical examples that we can bring back and look to address them interdepartmentally at the federal level, as well as recognizing other jurisdictions as well as the need for coordination on that front.
Mm-hmm. So, okay, let's look at this, our poll for a moment. It looks like we got a handful of answers here. Nari, do you want to, can you reveal those with us? And then I'm gonna open it up for the panelists. If any of you, Dave and Tia, perhaps in particular, if you wanna respond to what you're seeing there. And then I do, what do I want to ask? I think, like, if we want to transition to a more resilient, regenerative food system, and I think it is a real question, like, if we do want to do this, okay, I'll come back to it in a second. We have our answers up. Okay, so what are we struggling to see? So garden seeds, nutrients, biologicals. Okay, plain cooked chicken breast, grilled salmon with limited ingredients, frozen fruit and veg grown in Canada. I'm going to pause on that one. For years, Nourish cohorts have repeatedly come back to the same question, which is, why is there not an Okanagan Valley fruit cup, a Niagara fruit cup, something that can go to their patients? Why is this not there? Anyways, that one, being a processed value add part of the food system, that Jen and I were joking the other day, like, should Canada just go, or should Nourish just go into the business of, like, trying to meet some of these things? And, of course we chuckled and said, that's not for us. Let's leave it to the experts. But okay, let's see. Naira, if you want to keep scrolling, it's hard to see. I'll read. Made in France dairy products. Interesting. So dairy-free, gluten-free products, ready-to-eat soups. I think Aylmer's just has a great ad around their tomato soup, if you didn't catch it, or worse, Googling. Applesauce that is made in Canada. There's huge capacity, we know, out of Rougemont with apple orchards and the townships in Quebec. BC long-term care regulations currently do not allow us to purchase from local food suppliers. Our certified single supplier for food supplies does not list local products. Okay, interesting. Yeah, we're going to come up against these kind of like policy and also some normative, like, perceived barriers around what's possible. Okay, so Nairi, you can just do a quick flip to the bottom of that one, and you can just scroll. People can look at that, and I'm gonna move to this next question, which is, like, do we want to transition towards more regenerative food systems? Like, are we ready to kind of make that sort of commitment? And if so, where do we think governments or institutions ought to be building the infrastructure, the capacity that we're missing? So, Josh, I think you have thoughts on this, and Tia. So Tia, let's start with you.
Sure. Well, we have an organic action plan that actually details out exactly what it is that we need to build a strong regenerative system. And we've been working on this for 2 years. We've done comparatives of what the federal government and provincial government spends are in the US and the European Union in regards to assisting. And Canada, if you take I think it's 8 times more spend in the United States and $200 more, or 200 times more spend in the European Union. So organic has really been market driven. It's not been because of policies at a federal level. It has really been consumer choice. We are the 5th largest organic market in the world. And usually when there's a market opportunity, that will drive transition. But right now, I think the biggest thing is that we've seen a small decline for the first time ever. That we have a decline in regards to operators, because it has become quite difficult with pricing in the last couple of years, particularly in the prairies. And I guess we're quite concerned that these tariffs might just drive a lot more people away from that, simply because they need to sell to a conventional market just because of the market opportunities being lost. So I think that, the government has many interests in moving towards more regenerative organic farming systems. We'll see what happens, of course, with the election and where that might change the policies moving forward. But there has been an interest or an intrigue, certainly, by more and more farmers and the word regenerative, even though it doesn't have a definition, it helps bring people to the table to discuss what does that mean. Yeah.
Josh, did you want a quick hot follow on that one?
Sure. I think there's just a couple of other pieces. One, and I'm glad Dave's on the call too, because I think food hubs and those kind of infrastructure pieces really do matter here. And I think lots of us are involved in either operating them or buying from them or would like to be. And so thinking about what does it take to really build out the infrastructure of food hubs so that smaller producers at least, have a pathway to market, right? Is a really big piece of this. I think that's especially true now. To bring in another big thing that's happening, there is now a national school food program, and suddenly we're building out the infrastructure to supply thousands and thousands of schools as well. And there's a chance for those two things to be solved, to have one thing solve both of those problems, right? And that's building out that kind of community-based infrastructure. I think the other last thing I'd say is at our end, there are regulatory barriers which are really challenging, or there are things that happen, I think, in terms of smaller jurisdictions. So we don't have a federally inspected abattoir in our entire province, right? And we only have 9 Canada GAP certified producers in Newfoundland and Labrador at all. And by and large, the large healthcare institutions are looking to buy from folks who have Canada GAP, the large stores are. So figuring out what does it take to create those regulatory pathways for people whom just the economics of it, especially in far-flung parts of the country, who are trying to do really creative things with food, how to get them into that kind of landscape of opportunity as well.
Well, and I think it's interesting because there's some embedded assumptions, like, I did read a piece that Food First NL put out, like talking about this issue about the absence of federal abattoirs. Healthcare typically, like, it's like an unwritten policy, I would say, to require federally inspected. Provincially inspected meat is also safe. The distinction between provincial and federal inspection is about the ability of that meat to cross across provincial and territorial borders. It's not about the safety of that meat. It's about that movement of the good. I think there's a real opportunity here, one that is like way overdue for healthcare, to look at those unwritten, sometimes written norms around what we are expecting from Canadian producers, because it's just the barriers are, some of them are well-intentioned, and I would say they're not based on evidence or even what the policy is there to create. Jason, I'm going to loop back to you. Are there any specific areas that you are interested to see in terms of investing in capacity nationally? There will, of course, always be things we rely on global markets for. I don't see Canadians giving up coffee or chocolate. But are there any areas where you think that we could be investing domestically, or that you're hearing a lot of momentum around?
Well, I think in reflecting on your question, the most important thing is to consider where might those opportunities exist, and to have a thoughtful kind of discussion in terms of the different regional contexts across Canada and their respective opportunities and challenges. So I'd be hesitant to say this is the opportunity. What I might suggest is we take a more community-based approach to look at those individualized challenges and see, hey, what is it specifically? What are the impediments and barriers in place? What are the aspirations and priorities of those communities? And how can we collectively look together to realize them in a way that provides viable opportunities for farmers while addressing the community's needs?
Yeah, a great answer. And probably also not just farmers, but like if we take your place-based approach and we look to the East Coast, like the fishers and seafood producers, like industries that are going to be really hit. Okay, great. So I do want to turn a little bit, and I'm conscious of the time. So and I don't know how we're going to get through all these questions. This might have to be the first of many, but we talked a little bit about household incomes and food insecurity. I want to take a sec to turn toward history, because if we look at the history of any like food price crises, since like post World War II rationing, which I think actually saw people turn more to their kitchens, more to the seasons, and actually had positive health and public health outcomes. All of the crises since then, whether it's, you know, the 70s, like the related to the oil shocks in the or the global food crisis or the pandemic, we see households, especially lower income ones, turn to cheap calories, ultra processed foods. These things do not build health. We see that, you know, 80% of hospital admissions in Canada are related to diet-related disease. We know that 1 in 3 patients, when they're admitted to hospital, arrive malnourished. We know that they leave more malnourished on average than when they arrived. Like, this is not new, but now this is being compounded, and the media is reporting tons on this already. The stress because of job insecurity, potential job losses, increasing food prices in the context of inflation. I mean, have these interconnected food, health, and economic crises reached a sufficient magnitude for senior health leaders and policymakers to take bold action? More upstream preventative health strategies, you know, probably ones that can be achieved only through collaboration. But, you know, are we ready to meet the moment? And I'll turn that over to maybe Brenda. We can start with you. Do you see senior health leaders appreciating what the scale of what is could play out here?
I do. I think that like we have a small province, so we have a lot of senior leadership really support us, and they support us not just from within the hospital setting, from within Nova Scotia Health, who I report to this chief financial officer and VP, and he talks about local food more than I do. So like I do see, and we have a malnutrition strategy, which is a food first strategy as well. So when we do know that when patients come to the hospital, half of them are malnourished, and to what Hayley said, half of them do go home malnourished, and that's why we have a food first room service strategy. The room service strategy is the standard of care that we provide in our hospital so that we can combat that malnutrition and make them go home faster. Malnourished patients also stay in hospital 2 to 3 days longer, and you know that is cost the health system a lot, which we could invest. So I think the way we've been looking at it, and the way we look at our local food strategy, is it's about the food and it's about sustainability and the environment, but it is about economic growth, and economic growth leading to increased jobs. And so the more we can do from a local, and we partner with a couple of food hubs, to Dave's point about food hubs, and we have been really fortunate that they've showed us like so many things at the food hub that we could figure it out. So we've changed our menu to support what the food hubs can give us. We didn't say, this is what we want you to give us. We said, no, what can you give us? And then we'll put that on the menu. So it's kind of like that reverse engineering. And our cranberry juice and our apple juice is an example of, they wanted their workers to work all year round. So it's not just about putting the juice on the tray. It's about, okay, you want them to work all year round. Well, what can we do? And so we've walked the farms. We have a mashed potato that comes from a little local food hub here that feeds all the patients across our province. So we walked through the farm. These were potatoes that would have just been left in the ground. So they're not impacting the environment, but also we can get really great. We've developed the recipe. We help them we help them get support for the equipment. So it's a real in-step partnership, but I think it all goes around to say that from a food insecurity perspective, it's not just about the food, it's about getting the jobs. And so if we can have local food systems, we would have better jobs. I'm gonna call Dave after this call and say, what else can I do in the food hubs?
Well, I mean, yeah, that's great. And I think so off, yeah. Dave, panelists, would anybody else like to weigh in?
The piece that I've been wanting to the point I've been wanting to make, but I'm not sure where it fits in, is it goes back to this idea of like income security equals food security in my mind, right? And it's stunning and abhorrent that like agricultural workers have almost no rights. They do have some protections under Employment Standards Acts and everything, but they're exempt from a lot of them. And what I see is a lot of small farms taking on the burden of saying, okay, how do you ensure living wage? So I loved when Brenda was saying that, there was a farmer looking, how do they employ their people year round? And she worked with them on that. That's the tricky part of all of this. It's like, I had worked in food security and community food security for quite some time, and arriving at farming, I was like, okay, how do you approach this? Get what you need in order to like get the money you need as a farmer to do this work and pay the people working for you a living wage for this. And I somehow think, I can't find stats on this, but a wild assumption on my part is like some of the people that are making use of emergency food services in our communities are also working in our food value chain somewhere in there. And that for me is a very crazy thing to think about. And as we think about institutional food procurement, we have to be thinking, or any sort of procurement, we have to be thinking about the income security and being like the job creation in that. So the shifting of that, I'd love to see more folks doing it. Um, I'm happy to talk to people. I see a lot of comments in the chats around some of the challenges of capacity of their nearby hub and how do they aggregate food to supply their school districts. I'm not sure there is an answer for this. It took, our society decades to arrive at this food system we have now. It's going to take us hopefully not as long to figure out a different way. And for me, it's a both and. It's both regional food systems and it's an export market. But so it's not an either or. Like we will always rely on trade. I'd love to see that be more fair trade, because like free trade isn't necessarily fair trade. We have to keep that in mind. But I think our domestic trade policies and what's happening at a regional level should be like fair trade, where we're respecting the people, the environment, the authenticity of the ingredients and who's growing it, as well as the nutrient density of that food. Like small growers, there's a growing body of evidence out there that the nutrient density of folks that are using regenerative practices, as broadly as those are defined, have greater, like their produce has greater nutrient density than large scale agriculture does, especially from a historical perspective. So a lot of me is hope and optimism. And then through the food hub, it's finding the way to make all of this happen through aggregation and finding those other people who are hopeful optimists and misfits, because there is a path forward, but it's going to take creativity and perseverance. And at the end, I think, there's income security, which will reduce the food insecurity at the same time.
The income security one is also it's such an important part of the puzzle. And I think like one of the things I want to actually train our focus to is like, I think there's a real possibility that unless we address the underlying conditions of what makes folks food insecure, I mean, and this is not to say that we don't do the income supports program. I think there's wonderful policy ideas out there and we support them. And if there's not pathways to meaningful livelihoods for folks, barriers to entry into markets, the ability to access lands, like we think about how marginalized Indigenous Canadians are on like 0.02% of lands in Canada, like ability to make a meaningful life, then there is a kind of dependency that can be perpetuated that is kind of, I would say, counter to what Cindy Woodhouse, who I quoted earlier, spoke to. So I think there is this piece, and I don't know if anybody wants to speak to it, but it's just like, how do we weave in a values-driven kind of like reconciliation informed? And I don't mean reconciliation light, I mean like a genuine desire to weave the wisdoms of Western and Indigenous ways of knowing in all of their plurality and beauty in regional ways, you know, in order to move forward. So it's a huge question. I'm going to ask Nairi to put up the poll that we have for participants and ask the panelists, you can respond as well, in terms of ideas that you have to be moving forward. We're going to run out of time way faster than I would like. So folks, take a moment to share. What do you think? What solutions are you seeing? And I'm going to combine the two polls, Nairi, into one. So just once that poll gets up, what solutions are you seeing? What do you want to see Nourish champion and prioritize? What do you want Ottawa to hear? What do you want your health, your chief medical officer of health to hear, the health authority director? What do you want in terms of capacity for small and mid-sized producers, harvesters, hunters? Let's throw out all of your ideas at us. We're going to be capturing all of these. And I think we'll have to move very sadly towards a closing. There's still so much I want to get to. And actually, I also wanted to invite Brenda, like you might want to put it in the chat or in your closing comments, like you're going to get a lot of emails about how were you successful in partnering with, you know, local food hubs. This is just like, there are these like scale mismatch questions that come up time and time again. So would love to hear either in the chat and your closing comments around that. So I think with the time that we have, I'm going to ask all of you kind of whether it's, I mean, well, the idea we did want to put out there is we so clearly could use a mandate from, well, actually, I'll share a very brief story. Nourish is a fundraising organization. We write grants and that funds our work. And we've gone to both Health Canada and to the Public Health Agency of Canada for funding. And we have been declined more than once because Health Canada says we're too focused on preventative health. And the Public Health Agency of Canada says, well, you work with hospitals. So we're in this tricky, very frustrating, infuriating place. So I'm just really wondering, like, what, now I'm kind of forgetting where my question was going, but what does it take? Like, what ideas do you have to be able to transcend these current sort of limiting paradigms that we have? What is it going to take to move from isolated, reactive changes to really coordinated national strategy around healthcare food procurement and beyond, really recognizing that fundamental role of food and health and healing. So to all the panelists, I'm going to give you like 30 seconds for your closing thoughts. Like the elevator doors are closing. What do you think it takes to move from kind of reactive, isolated responses to more coordinated, thoughtful, values-driven, future-building responses? And whoever's ready first, you can just chime in and start.
I'll go. I really think that it's going to really continue to be pushed by the not-for-profit sector, building these bridges and the food hubs. We haven't talked about the Small Scale Food Processors Association, which is building national hubs all across Canada. But I think that it's going to be the will of the NGO community and building these partnerships, and then really wrapping it up pretty and asking Ottawa to help fund things a little bit more. We haven't had a discussion today about the national food policy, like what's happening there, right? So I think I'll leave it there. My elevator door is closed. Go ahead.
Thank you. Appreciate your other panelists, appreciate that. Who is ready to go next?
I can go. I think one thing I'm left with is that we're talking about healthcare as the solution space here, which is, I think, exactly right. But the decision making and the recognition of this has to go outside of healthcare, right? Like, this is a good moment for getting the people who are in, working in transportation, the people who are working in logistics, the people in different government departments who don't necessarily think of health as being part of their mandate to do that, right? And I think we have a food security working group here, and last week was the first time intergovernmental affairs showed up because of the tariffs. And they were really interested to suddenly hear what all the food people were talking about. So that kind of interdepartmental, cross-disciplinary work has got to be a part of the solution.
Great, thank you. Brenda.
So much to think about. So it's been great being part of this panel today. I guess my closing comments would be like not to think beyond the barriers. Don't accept the barriers. I would say when we think about our food hubs, the biggest thing that came to us, like they wanted to make to do food for us. They wanted to, slice the carrots and to do all those good things for Nova Scotia. So I think what we came up with was the biggest barrier was transportation. So how do they take all this food and bring it to 40 different places? So we met with our master distributor and we said, we want the local food hub to send the food that they're going to send us to you. And then you're going to bring it to us when you're bringing everything else. And so, originally they really weren't keen on that, but then we're like, this is what we need you to do as our master distributor. Contracts come up for renewal. We'll think about all those things. I'll say. So, and that's what they do. So none of the food hub folks deliver food directly to any hospital or any of our long-term care facilities. It all goes to our master distributor, and then we just order it like we order any other food. So I'd say don't accept the barriers.
Great point. Those contracts are powerful, really powerful. If you, okay, super. Jason.
Maybe just say I'm super looking forward to hearing about the solutions that get brought forward through this webinar, and I hope those can be shared. Hayley, love to see them. And just to acknowledge all the great work that's already taking place that we heard about today. I think one of the key things is to discuss and share what are some of the barriers and impediments, and then how can we work collectively to have those addressed, and recognizing roles and responsibilities. I think within that, having a shared definition of success is also super helpful. So pulling the same direction, that's something that I've certainly seen in my role in food policy. And finally, Tia, I'd love to connect to talk about the food policy for Canada. I can assure you it's still going.
Hey, Dave.
My closing thoughts are, it's going to take creativity and perseverance. There aren't easy answers in this. If there were, we'd already be doing it. So you do have to it was what Brenda was saying, don't accept the barriers as barriers. But then the hard reality of the business and the financials does hit the wall at some point. And this has to make sense for everybody if you want those living wages to work. And a lot of this is going to require, I think, capital investment in the missing middle of our food system. So how does the food get from the people growing it to the people who are going to eat it? And I think that's where there's really interesting small little pilots happening right now around alternative ways of raising capital and investing in food. And I think it's about trying to develop those more and looking at what does it look like for community ownership of our food system. You can have that in almost any legal structure technically, but you just have to, again, get creative on what that looks like, so that, the people who work in our food system, who grow our food, who eat our food, who distribute our food, they're the ones who, I think, and it's possible if we reimagine it this way, could own the food system and derive the benefit when there are profits to be distributed. I think there's creative models out there that are worth exploring. And the financial
I'm gonna
capital
stop
will
you
lead to
there,
the social capital.
Thank you. So it will have to be continued. Thank you, panelists, for an incredibly rich discussion today, and for the generosity of your time, for putting yourselves out there. To everybody listening, we will share the responses that you shared. We're out of time today, but expect them in a blog, and panelists will share them coming out to you. We absolutely want to get more ideas flowing. It's now turned into a teaser. To everybody, kind of Subscribe to our newsletter to stay tuned. Follow us on LinkedIn and Instagram. Please donate to Nourish if you learned something today, and complete the valuation survey that will go out. And then I just want to leave you with the words of then Minister of Health, Mark Holland, who I had the pleasure of hearing speak a few months ago in the fall about the future of healthcare in Canada. And I think his words resonate across sectors. And he said, a world of unimaginable joy and prosperity is possible, and we should demand it. Hold it in our heart, talk about it, and evaluate against it. We should not abandon it. So thank all of you for coming today, for not abandoning hope on a better future that's possible, not just a reactive one, but one where we make this place one that we're even more proud to live. So thank you for staying with us. We'll talk to you soon.